Welcome to 5-Minute Fundamentals. This short lecture provides an overview of key concepts from Pearson's medical language, Immerse Yourself, by Susan M. Turley. Please note, this is a brief summary. It's not a replacement for the full review. For deeper understanding, examples, and practice, be sure to read the textbook and explore the complete resources available on Pearson's MyLab. Now, let's scrub into today's 5-minute focus. The eye is a complex sensory organ designed to gather and send information to the brain. Housed in a protective, bony orbit of the skull, each eye is cushioned with fat and connected to blood vessels and the optic nerve. The eyelids, eyelashes, and lacrimal glands help protect and moisturize the eye, while the conjunctiva produces music to trap debris. The iris controls the size of the pupil, regulating how much light enters the eye. Just behind the pupil is the lens, which changes shape to focus light on the retina at the back of the eye. The retina contains rods for black and white vision and cones for color. Other key structures include the sclera and the cornea, and fluids like aqueous and vitreous humor, which nourish the eye and maintain its shape. Light rays first enter the eye through the cornea, then pass through the lens, which bends and focuses the light through refraction. The ciliary muscles adjust the lens shape to fine-tune the focus. Light from objects we're looking directly at hits the fovea. This gives us the sharpest, clearest image. Light from the edges of our field of vision hits the peripheral retina, giving us peripheral vision. Once light hits the retina, these cells generate an electrical signal. That signal travels through the optic nerve to the optic chiasm, then to the thalamus, and finally to the visual cortex in the occipital lobe. There, our brains flip the image right side up, gives it depth, and connects it with memory so we can understand what we're seeing. Some common ophthalmic diseases and disorders of the eyelids include blepharitis, blepharoptosis, ectropion, and ahordelum. Disorders of the lacrimal glands include dacryocystitis and xerophthalmia. Disorders of the conjuncta, sclera, and cornea include conjunctivitis, corneal abrasion, and exophthalmos. Disorders of the extraocular muscles include nystagmus and strabismus. Disorders of the iris, pupil, and anterior chamber include anisocoria, glaucoma, hyphema, and uveitis. Disorders of the lens include aphakia, cataract, and presbyopia. Disorders of the posterior cavity and retina include color-deficient vision, diabetic retinopathy, floaters, flashers, macular degeneration, night blindness, papilledema, retinal detachment, and retinitis. Refractive disorders of the eyes include astigmatism, hyperopia, and myopia. Conditions of the visual cortex in the brain include amblyopia, blindness, diplopia, and scotoma. Common radiologic procedures include fluorescein angiography and ultrasonography. Medical procedures include accommodation tests, color-deficient vision testing, dilated fundescopy, eye examination, eye patching, fluorescein staining, slit lamp examination, tonometry, and visual acuity testing. Medications include antibiotics, antivirals, corticosteroids, drugs for glaucoma, and mydriatic drugs. Surgical procedures include blepharoplasty, capsulotomy, phacoemulsification, corneal transplantation, enucleation, hyperopia surgery, keratoplasty, laser-assisted in situ keratomileusis, photorefractive keratectomy, photodynamic therapy, cryopexy, vitrectomy, strabismus surgery, and trabeculoplasty.